Good day, everyone. We're diving into the fascinating world of AI and drug design with our presentation titled Generative AI for Designing and Validating Easily Synthesizable and Structurally Novel Antibiotics. This groundbreaking research tackles the urgent need for new antibiotics, leveraging AI to explore vast chemical spaces and design novel, effective molecules. Prepare to be intrigued by how SyntheMol, our generative AI model, is revolutionizing the fight against antibiotic-resistant bacteria. Let's begin. The urgency for novel antibiotics is evident with the rise of drug-resistant infections, particularly the ESKPE pathogens and A. baumannii, a bacterium notorious for its virulence and drug resistance. Traditional drug design methods, while valuable, face limitations. They inefficiently explore the vast combinatorial chemical spaces and require time-consuming evaluation of molecules individually. To address these challenges, we developed SyntheMol. This generative AI model leverages molecular property prediction models and a Monte Carlo tree search. It's designed to create structurally novel, synthetically tractable, and effective small molecule antibiotic candidates. This innovative approach allows us to rapidly and accurately identify promising drug candidates, a significant step forward in the fight against antibiotic resistance. The application of our novel generative AI model, SyntheMol, has led to some significant breakthroughs. We've used it to design antibacterial compounds specifically targeted against the bacterium Acinetobacter baumannii. From this process, we synthesized and tested 58 structurally novel and diverse compounds. The results were promising. 6 of these compounds showed potent activity not only against A. baumannii, but also against other species within the ESKPE group of pathogens. This demonstrates the potential of SyntheMol in designing effective and novel antibiotic candidates. The rise of antibiotic resistance is a global health crisis. In 2019 alone, nearly 5 million deaths were attributed to drug-resistant infections. If we don't act now, this number could skyrocket to 10 million per year by 2050. Among the most dangerous pathogens are the ESKPE species, with A. baumannii being particularly virulent and resistant to drugs. To combat this, we've developed SyntheMol, an innovative AI method for designing novel antibiotics. The image here provides an overview of how SyntheMol works. It's a generative model that assembles novel compounds, aiming to outsmart these resistant bacteria. The global spread of antibiotic resistance is a pressing issue in modern medicine, with A. baumannii being a particularly critical concern. The urgent need for structurally and functionally novel antibiotics is clear. Artificial intelligence has shown promise in drug discovery, with its ability to rapidly identify promising drug candidates. However, traditional AI models evaluate molecules individually, which can be time-consuming when dealing with large chemical spaces. This is where generative models come into play. These models construct molecules from scratch, assembling molecular fragments into larger molecules with desired properties. Despite their potential, few studies have synthesized and tested the molecules generated by these models. Furthermore, none of these methods have been applied to antibiotic development, an area that urgently requires innovative approaches. Our study aims to address this gap by developing SyntheMol, a generative AI model for designing novel antibiotics. This model uses a Monte Carlo tree search to assemble novel compounds, exploring a vast chemical space to identify promising molecules. Stay tuned as we delve deeper into the workings and results of SyntheMol. SyntheMol, our novel generative AI model, leverages the power of Monte Carlo tree search to design new compounds. It's like a master chemist, assembling molecules from a vast library of around 132,000 molecular building blocks. But it doesn't stop there. SyntheMol also employs 13 chemical reactions, allowing it to explore a wide range of possible combinations. This innovative approach enables us to navigate the complex landscape of combinatorial chemical space and generate promising molecules with desirable properties. SyntheMol, our generative AI model, is a game-changer in the field of small molecule drug design. It's not just a tool, but a revolutionary approach that explores a vast combinatorial chemical space to create effective antibiotic candidates. But what sets SyntheMol apart? It's the unique combination of molecular property prediction models and Monte Carlo tree search, or MCTS. This allows us to efficiently and rapidly identify promising drug candidates. It's a leap forward from the traditional method of evaluating molecules one by one, which can be time-consuming and less efficient. In essence, SyntheMol is a powerful tool that accelerates the process of drug discovery, making it more efficient and effective. It's a testament to the potential of AI in revolutionizing healthcare and medicine. SyntheMol, our novel generative model, is built upon a foundation of approximately 132,000 molecular building blocks with known reactivities. These building blocks, combined with 13 well-validated chemical synthesis reactions, allow us to assemble novel compounds and explore a vast chemical space of nearly 30 billion molecules. But how do we guide this exploration? We train SyntheMol to design molecules with a specific target in mind. In this case, antibiotic activity against the drug-resistant bacterium A. baumannii. This approach is not just about creating new molecules, but about addressing a critical global health issue, the urgent need for novel antibiotics to combat drug-resistant bacteria. In the next part of our presentation, we'll delve deeper into the Monte Carlo tree search algorithm that powers SyntheMol's exploration of the combinatorial chemical space. Stay with us as we unravel the intricacies of this fascinating process. Our research has been validated through both experimental and in silico methods. We synthesized and tested 58 molecules generated by SyntheMol, and found that 6 of them showed potent activity against a baumannii and several other diverse bacterial pathogens. This not only confirms the effectiveness of the molecules generated by our model, but also highlights the potential of AI in the development of antibiotics. Before we applied SyntheMol to antibiotic discovery, we evaluated its performance in silico using CLOGP, a measure of the computed octanol water partition coefficient. This step ensured that our model was capable of generating active molecules. This rigorous validation process underscores the robustness of our approach and its potential for future applications in drug discovery. In our research, we first focused on generating CLOGP molecules. We created a CLOGP training set and used it to train a CLOGP chemprop model. We then ran SyntheMol with this model for 20,000 rollouts. This process showcased SyntheMol's impressive ability to rapidly and effectively search a vast combinatorial space for active molecules. Next, we applied SyntheMol to discover potential antibiotic candidates against a baumannii. We used 3 antibiotic property predictors in this process. The results were promising, with the generated molecules showing significantly higher antibacterial property prediction scores than random samples. This demonstrates the potential of SyntheMol in the field of antibiotic discovery. Our research has yielded promising results. The molecules generated by SyntheMol exhibited significantly higher antibacterial property prediction scores compared to a random sample of real molecules. This indicates the potential of these molecules as antibiotic candidates. Moreover, the generated molecules were diverse, incorporating a wide array of building blocks and all 13 reactions. This diversity is crucial, as it allows for a broad exploration of the chemical space, increasing the chances of discovering effective antibiotics. These findings confirm the success of SyntheMol in generating promising antibiotic candidates. In our study, we applied our novel generative AI model, SyntheMol, to the design of antibacterial compounds specifically targeting a baumannii. This resulted in the synthesis and testing of 58 structurally unique and diverse compounds. Impressively, 6 of these molecules demonstrated activity not only against a baumannii, but also against other species within the ESKAPE group of pathogens. These findings underscore the potential of generative AI models like SyntheMol in the realm of drug design, particularly in the creation of novel, effective antibiotic candidates. As we draw our discussion to a close, let's revisit the key contributions of our research. We've developed SyntheMol, a groundbreaking generative AI model that's revolutionizing small molecule drug design. We've successfully applied this model to design antibacterial compounds specifically targeting baumannii. Our team synthesized and experimentally tested 58 structurally novel and diverse compounds generated by SyntheMol. The results were promising. We discovered 6 molecules with significant activity against not only baumannii, but also other ESKAPE species. The figure you see here is a heat map summarizing the minimum inhibitory concentrations of the 58 synthesized molecules against baumannii. It also shows additional testing of the 6 high-activity molecules against a panel of ESKAPE species. This visually represents the effectiveness of our approach and the potential of SyntheMol in the fight against antibiotic resistance. In conclusion, our work demonstrates the power of AI in drug discovery and the potential of generative models like SyntheMol in addressing critical global health challenges.